Hi, Nikki.
Hi.
My name is Dr. Mad. How are you doing today?
I'm doing well, thank you.
Wonderful. I see here that you're in for a head-to-toe examination. When was your last checkup?
Over a year ago.
Okay. Can you please verify your last name?
Yes, Mar, M-A-R.
Okay. And your date of birth?
June 15th, 1998.
Okay. All right. Do you have any allergies?
No, just normal dust and pollen.
And are you taking any medications?
I take allergy medication and an asthma inhaler.
Okay, perfect. So now we're going to go ahead in the medical history. You do have asthma?
Yes.
How long ago were you diagnosed?
4 or 5 years ago.
Okay. And when was your last episode?
3 months ago.
Were you okay with the inhalers that you have, or did you have to go to the emergency?
No, the ones I have work.
Perfect. Okay, and the medication, is it PRN or you have to take it on a daily basis?
It's daily.
How many times per day?
Twice a day.
Twice a day. Okay. Do you have hypertension?
I don't.
Okay. Any digestive problems? Nausea?
No.
Are you experiencing any headaches, confusion?
No, nothing like that.
Okay. And do you wear contacts right now?
I do.
Okay. When was your last vision checkup?
6 months ago.
And have you noticed an increase?
No,
It
everything
stayed the same?
Yeah.
Right. Any bumps or anything abnormal on the skin that you would like me to check in particular?
No, not that I know of.
Any pain right now?
No pain.
So on a scale of 0 to 10, how would you rate the pain? 0. Perfect. No, that's exactly, I know it's redundant, but I just want to make sure.
Mm-hmm.
Any hospitalizations?
No.
Okay. Any injuries?
No.
Okay, let's talk about family history. Anything from maternal or paternal side of your family? Any endocrine disorders, hypertension?
My mom's side has high cholesterol. My dad's side has type 2 diabetes and hypertension.
Okay. Alright, let's go ahead and take your vital signs. Okay, I'm going to check your blood pressure. Is the left arm okay? Okay, relax. Right. Blood pressure is 108/65. Go ahead and slow this down. I'm going to check your pulse. I'm going to put 2 fingers around your wrist. Okay, pulse is strong and symmetric on both sides. No signs of heart failure or any cardiac congestion. I'm gonna go ahead and listen to your heart. So I'll have you breathe normal. I can hear only S1 and S2, no S3, no S4. Now we're going to listen for murmurs. Can you go ahead and take a deep breath in and hold it in for 1, 2, 3. Breathe out. Very good. I'm going to listen to your lungs as well. Take a deep breath in and exhale. Good. One more time. Take a deep breath in and exhale. Okay. I'm going to listen to the signs. I'm just going to lift your arm up a little bit. Breathe in and breathe out. One more time. Breathe in, breathe out. Okay. And now we're going to listen to your carotid. So that's going to be placed on the side of your neck. Go ahead and take a deep breath in for me and hold it for 1, 2, 3. Breathe out. And same thing on the other side. Alright, breathe in and hold it for 1, 2, 3. Breathe out. Alright. No distension there. Okay. I'm going to take the head circumference. That's exactly 60. Slight asymmetry. Okay, go ahead and keep this arm straight. 71. Okay. All right. I'm going to have you cover one eye now. And with the other hand, go ahead and hold the Snellen chart. I'm going to have you extend your arm all the way. And can you read this row starting with the first letter to the left?
C, F, D, H, J.
Okay. And now the last row.
L, T, E, P, H.
Okay. Go ahead and switch. So now I'm going to ask you to read this row starting with the first letter to the right.
J, H, D, F, C.
And the same thing starting with this letter.
H, P, F, T, L.
All right. I'm going to check your optic nerve. For that, I'm going to ask you to look behind me straight at the wall. And I'm going to shine a light in your eyes. Just try to keep your eyes open as much as you can, okay? Okay, I'm not seeing any inflammation behind the retina. Let's go ahead and check your ears. Have you noticed any inflammation or any abnormal discharge coming from the ears? No. Okay. I'm going to have you look that way for me. Okay, go ahead and relax. The tympanic membrane is broke, right? There's no signs of inflammation. Okay, there's no redness here. Just a little bit of extra earwax, but I'm able to visualize the tympanic membrane and it looks good. Okay, I'm going to do a mouth exam. Go ahead and give me a big ah. Okay, and is it okay if I do a dental checkup as well? Sure. Okay, so what I'm going to do is I'll slowly tap on each tooth. Let me know if you feel any kind of pain or sensitivity, okay? All right, perfect. When was your last dental checkup?
In November.
Okay. I'm going to put that tuning fork behind your ear. Can you please tell me when you don't hear it anymore?
There.
Okay. Go ahead and close your eyes. Go ahead and tell me when you don't hear the sound anymore.
There.
Okay. Now I'm going to put it in two positions. One is going to be louder. Go ahead and tell me which position here is louder for you.
Okay.
This is position 1. And this is 2.
2.
Okay. And this is position 1. And this is 2.
2.
Okay. I'm going to check patency of both ears. Go ahead and breathe in, breathe out through your nose. And again. Okay, you're breathing a little bit better on the right side. Let's go ahead and check for deviated septum. Can you look up for me? Okay. Everything looks good. I'm going to have you close one ear, whichever you want. And go ahead and breathe in and let me know what this smells like.
Kind of like mint.
Okay. And we'll do the same thing on the other side now.
Peppermint.
Both of them. Okay. And now a bit of drop on your tongue. Go ahead and tell me if you can taste this.
Taste anything.
Okay. I would like to do a back exam just to check your neurological assessment and see exactly what's going on, because you did have some difficulty recognizing the smells and the tastes. Alright, so I'm going to have you turn towards the wall. Perfect. Okay. I'm going to go ahead and put your hair up. I'm going to start palpating, starting with the neck area.
Okay.
I am noticing a little bit of an eczema. Were you aware that you have this on the back?
Yes.
Okay. How long have you had this?
About 1 month.
A month. And do you know what could have caused it?
I don't.
Okay, were you recently at the beach?
No.
Okay, have you had any hair treatments done?
Yes.
Okay. I'm just going to go ahead and measure it. Does it hurt or does it burn?
No.
Did you try applying any lotion to see if it goes away?
I have.
Okay. Do you think it was a little bit bigger and it got smaller?
I think it stayed the same.
And when you first noticed it, was it painful, itchy, burning?
Just itchy.
Itchy, okay. I'm going to go ahead and take a sample and send it to the lab to see exactly if it's a fungal infection or part of the allergy. I would say it's more allergy induced, but we definitely want to make sure that we are very thorough. This is just an alcohol swab to make sure that we're cleaning the area properly before we take a sample. Does it hurt?
No.
Okay, we're going to send this to the lab. I'm going to tap on your spine. Let me know if you feel any kind of pain. We're trying to see if there's any neurological response. So we're looking at muscle twitching, any kind of sudden movement. Can you go ahead and tell me if you feel this on the left or right?
Okay. Left. Right. Left. right, 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 right.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
There. There.
Okay.
There. There.
Okay. Go ahead and tell me if this feels cold or warm.
Cold. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Cold. Cold. Warm.
Okay, definitely more sensitivity on the right side. I'm gonna go ahead and check your skin. We're looking for any elevations. I need to check hydration status, so that's just gonna be a little bit of pinching. I'm going to touch you with 1 or 2 pressure points. I'm gonna need you to tell me if you feel 1 or 2. This is what 2 is going to feel like. And this is what 1 is going to feel like. Okay.
2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2.
Okay. I'm gonna have you lay down now and I'll examine your scalp and your abdomen. Okay, and again, I'm just going to take a look at your scalp. Mostly I'm interested to see if there are any skin issues like the ones that we saw on your back. I'm not seeing any dandruff. No signs of inflammation. I did see some red patches here. I'm just going to go ahead and see if they're elevated. They seem to be pretty isolated, so that's good. No discharge. Go ahead and tell me if you feel this 1 or 2.
1. 1. 1.
What about now?
1. 1. 1.
I do see some signs of eczema. Some redness here on the right side. Okay, 1 or 2.
1. 2.
Go ahead and tell me if you feel this sharp or dull.
Sharp.
Sharp or dull?
Dull.
And now?
Dull.
And now?
Dull.
Okay, check your abdomen. Okay, to go ahead and listen to your abdomen. And as I'm doing that, I'm just going to check for any asymmetry as well. I'm not noticing any skin lesions, any protrusions. Bowel sounds are diminished on the left side. I'm going to percuss. Let me know if you feel any kind of pain. Good. I'm going to slowly palpate, looking at liver size. Organ doesn't seem to be enlarged. I'm not feeling any cysts on the right side. Checking right ovary, lightly pressing down, and compare it with the left. No pain. It doesn't seem to be swollen either. I'm going to slide a hand under. Good. Relax. Same thing on the right side. We're checking kidneys to see if there's any referred pain. Okay, very good. Alright, I'm gonna have you put your pants back up. Okay, Nikki. Go ahead and try to bring your toes towards you. Okay, a little bit more. I'm gonna try to push. Don't let me do that, okay? Perfect. And now try to push with your pads towards me. Okay. And I'm going to slide my hands under your heels. Now I'm gonna have you push with the heels, both in the same time. Very good. Okay. So symmetric on both sides. I have no concerns. We're going to go ahead and check your Babinski reflex. Let me know if you feel any kind of pain, but you shouldn't. Okay? Alright. Can you please tell me if you feel this on the left or right?
Left, right, left, right, both.
Checking capillary refill within 2 seconds. And checking pedal pulses as well. 2 plus. Symmetric on both legs. Good. Temperature seems to be normal. They're room temperature. They're not too hot, not too cold either. I'm going to check for pedal edema. And now I'm going to ask you to kind of like spread out your toes. Okay, I'm going to try to close them. Don't let me do that. You can relax this foot. Okay. Also looking in between the toes to see if there is any dryness. Looks good. Okay. I'm gonna have you sit back up. Okay. Alright, everything looks good. I do have some concerns though. We're gonna send you to get a CT of the head and neck. I do want to check that lesion a little bit better and make sure that there's nothing concerning. So I'm gonna have you scheduled for a follow-up in 2 weeks, and we're going to discuss the results of the CT as well, okay? Do you have any questions for me?
I think I'm good.
All right. It was very nice to meet you. I'll see you back soon.
Thank you.